A massive new research review has just arrived. Today, I'm going to give you the quick tour of the paper and the top 5 of the 8 frontiers in SCI research in the paper. And later this week, I'll upload a full deep dive on the whole paper. Okay, let's go. Frontier number 1, neuromodulation and neurostimulation. This is spinal cord stimulation, transcutaneous stimulation on the skin, deep brain stimulation, magnetic brain and spinal stimulation, even focused ultrasound and brain-computer interfaces. In human trials, epidural and transcutaneous spinal stimulation have already helped people stand, step with support, improve hand function, stabilize blood pressure, and sometimes bladder function, especially when combined with rehab. And early brain-computer interface work lets people use their thoughts to trigger stimulation and exoskeletons. Okay, on to frontier number 2, the high-tech rehabilitation. Here we are talking about robotic gait trainers, overground exoskeletons, and carefully structured training programs stacked with stimulation, with breathing interventions, or with smart pharmacology. When you stack the right therapies, people with incomplete injuries can walk faster, further, and more safely than with old-school physio alone. The message is clear. Rehab isn't just aftercare anymore. It's an active technology and a key part of any serious repair strategy. At frontier number 3 is smarter surgery and nerve rerouting. Early decompression of the cord and even opening the dura to give the swollen cord space are being refined and tested in large trials. At the same time, peripheral nerve transfers and nerve bypass surgeries are letting surgeons reroute working nerves above the injury into paralyzed muscles below. For some people, myself included, that has meant new hand function or better bladder control years after injury. These are not theories, they're procedures already being done in specialized centers. At frontier number 4, cell therapies. We're talking about mesenchymal stem cells, neural progenitor cells, Schwann cells, olfactory ensheathing cells, and more, delivered into or around the cord. Multiple phase 1 and phase 2 trials have shown that these approaches are generally safe and can produce modest but real improvements in motor scores, sensation, spasticity, pain, or bladder function in subsets of patients. And at frontier number 5, we have biomaterials, scaffolds, and smart drugs. Engineers are building hydrogels and 3D printed scaffolds that sit in the lesion, guide axons across, and slowly release drugs or exosomes to calm inflammation and support growth. Some of these scaffolds, loaded with a patient's own cells, have already been implanted in complete SCI patients, with early reports of regained sensation or partial walking in a few cases. On the drug side, we're seeing molecules that protect mitochondria, and even gene therapies that flip on regenerative programs inside neurons. Most of these are still in animal or early human studies, but they're moving steadily forward. And the real frontier? It's not any single one of these, it's integration. The future is almost certainly going to be personalized combinations. Stimulation plus rehab plus cells plus scaffolds plus smart drugs, timed and tuned to each person's injury. This new Frontiers paper doesn't give us a magic cure, but it does give us a clear message. The era of nothing can be done is over. The spinal cord is no longer a terminal organ. It's a complex system we're finally learning to engineer. Later this week, I'll upload a full in-depth video where I break down each of the full 8 frontiers. Today marks the 26th year since I suffered a spinal injury, and my hope has never been higher. My independence will return.
Thanks for listening.